Hello, we are doing insertion today. To begin with, I would check my orders to make sure I have the orders from a physician to insert the NG. I would then come in and ID the patient. I would gather my supplies and explain the procedure. I would establish a stop signal so that if things are getting too far, if it's getting too uncomfortable for him, we can stop at any moment of the procedure. I would then wash my hands and put on some new gloves. I would check his nares to see which nair would be optimal to use. I would ask if he's had any nasal surgeries, if he's broken his nose before, just to get an idea of which one would be best to use. I would then get my NG tube, and I would measure from his nose to his ear, then down to his xiphoid process. I would then put a piece of tape to label where I need to stop. I would coil the end of it to make it flexible, and after I'm done with that, I would put a little bit of lubricating jelly on there to make it go in easier. Then to start with it, I would have him put his head back just slightly, just so I can look in, and I would insert until I feel resistance or if I see that he is gagging. At that point, I would have him move his head forward while I'd have another nurse give him some water to swallow. And while he is swallowing, I would continue in with inserting of the NG tube until I've come to my marker. Because of the mannequin, I can only go in so far, so we'll just pretend that I'm to my marker. I would then get my pants tape. I would apply it to the bridge of his nose and get one of the ones looped around. I'm going to check for placement at this point with the tube. I would get a 60 ml syringe, and I would apply it to the end of my NG tube. Get my stethoscope. Listen to the xiphoid process. Of course, before I would hook it up, I forgot a step. I would pull back to at least 10 to 20 mils of air. Listen, and while I'm listening, I would inject the air. If I hear a whooshing noise, I know we're in the right place. And then I would pull back just slightly to see if we got any gastric juices. If I got some gastric juices, I know I'm in the right place again. We have a nice little doohickey thing here that we will apply for suction. Hook them up to suction.
Yeah, I want to get stopped. I forget something.
Yeah, there's no point just wasting time with that.
Oh, and also with the other part, I would just loop-de-loop once I know that we're in the right
I'm not
place.
actually listening. I hear it, and that's it.
Seems like you get
I would then, with my pigtail,
Go away.
pull back about 15 mils, I would say, of air. Get the valve off, and I would inject some air to make sure that we're not on the stomach lining, that pigtail is open,
Okay, ready?
and I would put that on. I would then secure the tubing to his gown. I would take my clean gloves off, remove the blue chucks. I would wash my hands and check for comfort of the patient, make sure everything's comfortable, and make sure he doesn't feel like he has to vomit or anything of that sort. And if he does, I would get Nimicin basin handy for him. And that's the end of into insertion.